despite all of the advances in the treatment of breast cancer, and there have been a lot of great advances in the treatment of breast cancer that have played a difference in women beating the disease, the number one thing that makes the difference, the number one thing, in real estate, we say it's location, location, location. Well, in cancer, particularly breast cancer, it's early detection, early detection, early detection.
What are some of the misconceptions of breast cancer?
Some people think that if it doesn't run in your family, you can't get it. Or the risk for getting breast cancer is only based on your mother's side of the family, not your father's side of the family. Some people think that young women don't get it, which they do. Particularly women of African ancestry have much higher rates of breast cancer younger than other women. Some people think that breast pain is because you might have breast cancer, or they think that if you have trauma to your breast, like if someone punches you in the breast or something like that, that you would get breast cancer. I mean, there are lots of myths out there. I think the most important thing is really to understand what are the risks for breast cancer. You know what I'm saying? Because pretty much everything else that you hear is pretty much not one of the risks.
So what are some of the causes of breast cancer?
Well, yeah, the things that put you at risk for breast cancer is if you have a family history of breast cancer, and a significant family history of breast cancer. So we're not talking like, I have a grandmother with breast cancer. That doesn't really increase your risk. We're talking like first degree relatives, mother, sister, you have a daughter with breast cancer, or a son for that matter, an uncle. Because if you have men in your family with breast cancer, that increases your risk even more than having women with breast cancer. Because if you see a man with breast cancer in your family, there's a high chance that there's a genetic mutation, one of those BRCA genes that is putting you at increased risk for breast cancer in the family, and you need to discover that. So family history of breast cancer, and especially early onset breast cancer. So I have a sister that was diagnosed at 32, or my mother was diagnosed at 28 or 40. That's a red flag also for your increased risk of breast cancer. And another thing that a lot of women don't know, if you have ovarian cancer in your family, that's actually a greater risk factor for breast cancer than actually breast cancer in the family. Some of the other things that we believe increases your risk of breast cancer has to do with the breast being affected by a long life cycle of estrogen and progesterone. So what do I mean by that? Early menarche, meaning the earlier you have your first period, and if you have menopause late, that's a long period of time that the breasts are bombarded with estrogen and progesterone every month. And estrogen and progesterone are the triggers for pretty much all breast cancer. So those are also risk factors. No, there's nothing you can do. You're not going to stop the period or anything like that. But it explains, some of what could be, and we've done studies looking at the way people of African ancestry break down the sex hormones like estrogen and Black men with testosterone. We hang on to the byproducts of estrogen and testosterone much longer than every other racial and ethnic group. Okay, which might be the reason when we say things like Black don't crack and all that kind of stuff, because it does have something to do with the youthfulness, but at the same time, Black men, for example, have 3 times the rate of prostate cancer than every other racial or ethnic group. Then the things outside of yourself, studies have shown things like alcohol can increase your risk of alcoholism, can increase your risk of breast cancer. But we believe that is related to body fat, because body fat, women who have increased body fat also have higher rates of, there's an increased risk of breast cancer. But why is that? Because body fat also can make estrogen. So there's added estrogen coming from there. Another one that has gotten a lot of attention too is chronic stress. I don't mean the stress of like, oh my God, what a day I had at work today, or, you know, these politicians drive me crazy. I'm talking about the kind of chronic stress like single women who have to take care of a family and an elderly parent, and they're the single breadwinner, and this has been going on for years. Or a woman who lives with domestic violence and abuse ongoingly. Or those women whose work causes significant stress to their bodies.
I was wondering if diet, like the thing that you eat, can impact kind of the effect that cancer has on you.
When people talk about they became vegan and it helped them, I think part of the effect of that is the mentality that came along with becoming vegan and how you started to actually honor your body, take care of yourself. It wasn't just that you're eating. I don't think it's just that you're eating vegan. It's the mindset that went along with that. Because if you look at people who do those things, you'd probably find out a lot of other things like yoga, meditation, you know, all the other things that they're doing that I think also have a healing effect on the body, and it's not just vegan. And part of the reason why I say that, and this is not to knock vegans, I'm not at all, but I have for many years had an issue with the food that we as people who live in the United States have to eat. And I don't care whether you're a carnivore, a pescatarian, vegetarian, or vegan. At the end of the day, our food supply is toxic. That's, you know, we eat, there's so much stuff with GMOs in this country. And even when you're buying quote unquote organic, depending on the country of origin, what you're calling organic on the west coast of the United States and what you're calling organic coming from Brazil or coming from Chile, it's all different. What they're allowed to put the label organic on is not what people think. Our biggest problem with diet in the United States is our food supply itself. It's not great. That's why many countries across Europe and the world will not buy our food. They actually are not. In fact, you could Google the term Frankenfood and you'll see Frankenfood has come to represent food from the United States. It's really important to me. And I'm just going to give you one other reason why I'm saying this. There were some important papers that came out of Howard University in the 1940s-ish, and the papers were entitled I'm forgetting the exact, but it was something like the increase in, it has something to do with like the increase in cancer mortality with the migration of the American Negro, okay? And basically what the researchers were able to do was to look at when Blacks left the South and moved north to more urban locations, that's when we started to see the increase in heart disease, hypertension, diabetes, cancer, all of that stuff started to grow up. Now, why is that? Well, if I just take how I grew up in the Caribbean, which was very similar to the rural South, my father and grandfather were the butchers for St. Thomas, right? Our farm was 444 acres. There was just a fence up, a little picket fence. All the cattle, pigs, sheep, goat, long before people talked about free range and grass fed, that's how our animals were. They were just out there, okay? If you were having a wedding or you needed to plan your menu for this coming week, you came and you talked to my father. You said, I want to cook goat on this day, lamb on this day, or I have a party coming up. Once he got all the orders, he went out, he found Bessie over here, Sarah, this cow, that goat, these pigs, whatever. He caught them, slaughtered them himself. They were fresh off the farm. It was fresh meat coming to market. And that's it. Then when you wanted your vegetables, you found the Rastafarians who came every day with whatever was grown locally. That's what you ate. And whatever fish you wanted, the fishermen were coming off the sea. It was all fresh. You couldn't get mangoes all year long. Now you could buy a mango all year long. Mangoes don't grow all year long. Mangoes grew in season. Bananas had their season. You know what I'm saying? There was a time for everything, and you ate what was harvested and what was available.
Mm-hmm.
And we've gotten away. We eat stuff all year long that's all been genetically modified to be produced.
Right.
So even if you're vegan, you're eating, a lot of times you're eating stuff that you shouldn't be allowed to even have it right now.
Right.
But we've made it so that it's readily available. But I do believe that our food supply has a big, plays a big role in why we see cancer and other chronic diseases the way that we do today.
Can you take a moment to kind of shine a light on male breast cancer? Because as you said, it's one of the misconceptions that men don't get breast cancer.
5,000 men every year get breast cancer. And again, usually you see it in the setting of a family that has an increased risk of developing cancer because of one of these genetic mutations that exist in the family. Most men who get breast cancer, it tends to be caught either early because they felt something and did something about it, and because men don't have much breast tissue, just by showering and they go, what's this little lump? Or they do nothing about it because they think it's nothing, and then it's, you know, a much bigger deal. But you don't recommend screening mammograms for men because, like I said, it's only about 5,000 men every year. And the treatment, they have just one treatment, basically. They require mastectomy. And then depending on what the results show, chemotherapy, no chemotherapy. Interesting enough, though, the majority of men with breast cancer, all of their tumors are estrogen sensitive. So many of them, most men will just get treated with tamoxifen, which is an oral medication for breast cancer, and do just fine.
Can you speak to the importance of self-examinations? Because I know a lot of my friends, it's not like something that is really pushed forth. So importance of self-examinations and how to do it.
There have been a lot of misconceptions about should you do breast self-examinations or you shouldn't. I encourage breast self-examination because what it does is it actually, again, alters the mindset of my patients, and they start thinking about their bodies.
Yeah.
So the breast self-examination has you thinking about your body. And my intention is not to have you be able to tell me you have breast cancer or not. I just want you to be able to tell me something is different.
Yeah.
That's my job to tell you whether it's something to be concerned about or not. So I do encourage it. And I have to tell you, I have too many examples of women who actually discovered their own breast cancer. I have one patient right now who is undergoing chemotherapy. She had a negative mammogram and she felt the lump. She felt a lump herself a month later, and she had just had a negative mammogram. I think it makes a difference. And how you do it, for young women who are still having their menstrual cycle, I say wait about 10 to 15 days after you no longer have symptoms. And at that point, the breast won't be as swollen and tender, and you'll be able to get a good exam. And you can start in the shower, just get one, and while you're showering, just feed with the soapy wet water, you'll get a nice glide all over the breast. Or you could just do like this, come in from, up like that. So whether you go circularly or in that, and then after you come out of the shower, you lay in bed.
Yeah.
And you lay flat and you do the same thing and feel while you're laying flat. And then also get up and stand in the mirror, look at your breast with your arms down, and then raise your arms and see if you see any dimpling or the skin pulling in anywhere, or does the nipple pucker, does something strange, because that may tell you that there's something wrong as well. For the postmenopausal woman who doesn't have to worry about the period, I say pick a date that you'll remember, whether it's when you pay your mortgage, your rent, or something, or, and that it becomes an occasion for you, and just do it on that day.
What are some of the most common forms of treatment for breast cancer?
Well, clearly surgery is the most common form, but you have to know when to do surgery and what type of surgery. If women with small tumors, you can conserve the breast and just do a lumpectomy. Oftentimes women with large tumors, You may need to, do a mastectomy unless you give chemotherapy up front and shrink it. And, the different things that you can do. But surgery is obviously the most common form of treatment. But what type and when is very important. Then there are what we call adjuvant treatment. So in addition to surgery, what can you also add adjuvant treatment for the treatment of breast cancer? And the most important one tends to be the systemic therapies. And the systemic therapies include both things that you give intravenously, like chemotherapy or other targeted therapies, or the drugs that you can give orally. I always want people to understand, no one dies of breast cancer in the breast. You don't ever die of cancer wherever it starts. If you have lung cancer, if you have ovarian cancer, you don't die just because you have cancer. That you die if that cancer spreads. So the minute it spreads to another organ, that's when you're at risk of dying. So why the systemic therapies are important, like chemotherapy or Herceptin, which is a targeted therapy, or the oral drugs, is because now you're sending out foot soldiers out into the rest of the body, hoping to find little cells that may have left that breast cancer, trying to go do some damage in the bones, the liver, the lungs, the brain. You're trying to go out there and grab them, knock them out before they do any damage. And then the third treatment that is important is if we conserve the breast and we don't do a mastectomy, most women will require radiation to prevent any recurrence of breast cancer in the breast. Or in those women who have significant disease because the cancer has already spread to the lymph nodes, then you need to sort of sterilize the general area of the chest and the lymph nodes with radiation.
Are there any last remaining marks that you want to make sure people know about breast cancer?
Despite all of what's happening out there, breast self-examination, get your mammograms when you're supposed to, starting at age 40. However, for African-American women, I usually recommend getting your baseline between 30 and 35 because of the higher rates of breast cancer under the age of 50 for African-American women. And if you have a family history of breast cancer, like a mother who was diagnosed at 40 or a sister that was diagnosed at 38, you are to start 10 years earlier than the youngest first-degree relative with breast cancer. So if your mother was diagnosed at 40, you need to start at 30. Your sister was diagnosed at 36, you need to start at 26. So knowing when you're supposed to have your screening mammograms, doing your breast self-examination is critical because, again, early detection saves lives. And that's the most important thing.